Dr. Joe here of the AskDrJoe.org and the 2020forum.com. So I've got a little letter here from one Caroline. She wants my advice on vitamin D supplementation. She says, "Dear Dr. Joe, I am confused as to how much vitamin D supplement I should be using daily. I see different doses on supplement bottles and I'm unsure of some of the doses I see on websites. How much do you advise I use? My last blood test showed vitamin D level of 55 nanomole per liter." Thank you, Caroline. Well, Caroline is right. If you surf different websites, you're going to see different dose recommendations of vitamin D supplementation. Now, I did a video on this subject about 2 years ago, and in that video, I shared with you the recommendations from 4 different governments from the Northern Hemisphere. And I want us to have a look at that video again, just a clip from that very video. So I've got down here, vitamin D daily intakes, okay? So we kick off with the US. Now, the US has recommended for adults to take 600 international units, which is the equivalent of 15 micrograms. And for the over 70s to take 800 international units, which is the equivalent of 20 micrograms. The UK has gone for a flat dose for adults to use 400 international units, which is equivalent of 10 micrograms. Canada has gone for adults to use 600 international units, which is the equivalent of 15 micrograms daily. And for the over 70s, 800 international units, which is the equivalent of 20 micrograms. Now, what about Ireland? Ireland has gone for 800 international units, which is the equivalent of 20 micrograms for adults, okay? Now, here's the other thing. The Endocrine Society believes that some of these doses are too small, okay? In actual fact, what have they gone for? The Endocrine Society believes that we should be taking between 1,500 to 2,000 international units, okay? And personally, I am with the Endocrine Society because I strongly believe those doses recommended by the authorities are just too small. But I think they should be the bare minimum. Optimal doses should be around the region that the Endocrine Society has recommended. Right. So as far as vitamin D supplementation is concerned, your first step is to find out what your current blood level is. Now, Caroline has done the right thing. She had her blood tested, and we know her blood level is 55 nanomole per liter. That is considered optimal. Now, how much vitamin D you're going to use will depend on what your blood level currently is. Let me just give you a little explanation as to the blood level brackets for vitamin D. So between 0 to 29 is considered deficiency state. 0 to 29 nanomoles per liter is considered deficiency state. Between 30 and 49 nanomoles per liter is considered insufficiency state. And 50 nanomoles per liter and above is considered optimal. In actual fact, the Endocrine Society believes that 75 nanomoles per liter and above should be the optimal levels for vitamin D. But, you know, that's an argument for another day. For now, we will consider 50 nanomoles per liter and above to be optimal. So Caroline has optimal levels. So for her, she only needs maintenance dose. Now, if you are deficient or insufficient, then you need higher doses. One suggested regimen is to use 50,000 international units of vitamin D per week for 6 weeks, and then you step down to maintenance dose. That is if you are insufficient or deficient. But if your levels are optimal, then you just want to keep them there. You just need maintenance dose. In fact, last year when my levels came back as 32 nanomoles per liter, that's what I did. I used 50,000 international units per week for 6 weeks, and then I stepped down the dose to maintenance dose. So that is for insufficiency and deficiency state. What about maintenance? How much vitamin D should you be using? Because that is Caroline's question. Well, here is where it gets a little bit tricky, because you may decide to go with what the government websites have recommended, and that ranges between 400 to 800 international units daily, and that's fine. You know, you can do that. However, you may decide to go with what the Endocrine Society is actually recommending, which is between 1,500 to 2,000 international units per day. Personally, I tend to go with what the Endocrine Society is recommending. So between 1500 to 2000 international units. But you may choose to go with the government recommendation of the lower doses. Now, on a personal note, I actually use 4000 international units per day. That's what I do. And the reason for that is my blood level is kind of similar to what Caroline blood level is. Mine came back as 52. But I want to get my levels up to 75, which is what the Endocrine Society is recommending. So for that reason, I use 4000 international units per day. That's what I use. And that's personal to me. But you don't have to go that high. You may stick to what the Endocrine Society is recommending, between 1500 to 2000 international units per day. Or stick with what the government is recommending, the lower doses. Obviously, if you are insufficient or deficient, you must be having a chat with your doctor, and then both of you will come to an agreed dosage for yourself. So hopefully this video has been helpful. If it has, please give the video a thumbs up. Please like the video. And please share this video with your friends, with your family, with your colleagues. If you've got any questions, any comments regarding the content of this video presentation, go ahead, leave your comments or questions down below. I think that's it for this video. Until next time, well, this is Dr. Joe signing out.